Sarah worked full-time as the manager of a local coffee shop. When her headaches started getting worse and more frequent, she knew she should see a doctor. But as a single mom with two teenagers and a $4,000 deductible, she just didn't have the cash to cover the expense. She took ibuprofen and kept working. When her daughter finally drove her to the emergency room 6 months later, the brain tumor had metastasized. Sarah died 8 months after that. She had insurance. It just didn't help her. Right now, 188,000 Vermonters have health insurance but can't afford to use it. They're underinsured, paying premiums every month for coverage with deductibles so high they might as well be uninsured. They delay care, ration medications, and hope problems go away. Sometimes they do, but too often, as with Sarah, they don't. 188,000 Vermonters are like a person furiously paddling in a large ocean, barely keeping their heads above water. One big ripple of water will pull them under, and then they will be inundated with medical bills they can't pay, with bankruptcy often their only way out. In a press conference last year, Senator Bernie Sanders spoke forcefully to the issue.
Everyone knows that our healthcare system nationally and in the state of Vermont is broken, it is dysfunctional, and it is wildly expensive. Nationally, the cost of healthcare per person, unbelievably, is $14,500 per person. In Vermont, it is even higher than that. This outrageously expensive health care is economically unsustainable, and by the way, twice as much per capita as other major countries spend, which in fact guarantee health care to all of their people. Now, despite that huge expenditure here in Vermont, many of our people are either uninsured or underinsured with high deductibles and co-payments.
Vermont's healthcare crisis touches every part of Vermont life. Medical debt burdens over 60,000 Vermonters. Families with insurance still go bankrupt from medical bills. People choose between prescriptions and groceries. School health care costs were the major factor in an average rise in Vermont property taxes of 14% in 2024. Every town meeting, we hear the same story. School budgets are unsustainable because healthcare costs are out of control. Small businesses pay $18,000 to $24,000 per employee annually for family coverage. Health insurance is often their second largest expense after payroll. Some drop coverage entirely. Young families are choosing to raise their children elsewhere because they can't afford health care in Vermont. Businesses relocate for the same reason. Entrepreneurs who would love to grow their businesses in Vermont don't come here because health care is just too expensive. For these Vermonters, our health care system has already collapsed.
Vermonters with debilitating conditions such as Crohn's disease, arthritis, or even cancer not only suffer physically, but then financially. The cost of Neulasta, a cancer drug that's critical to treating patients on chemotherapy, has an average cost of $1,300 a year. In Vermont, patients may pay tens of thousands of dollars to receive that exact same drug. At the same time, our primary care providers and our FQHCs can barely financially survive. It's backwards and it's wrong, and it needs to change. We are at an inflection point, there is no question, and Vermonters expect its healthcare leaders to band together, set aside self-interest, and create a healthcare system that works for the people. Thank you.
Current Vermont law requires that Vermont ensure universal access to and coverage for high-quality, medically necessary health services for all Vermonters. Systemic barriers such as cost must not prevent people from accessing necessary health care. Hi everyone, I'm Mike Palmer, and I want to share with you one simple thing you can do to help fix this problem for good. Along with hundreds of others, you can circulate a petition to ask your town meeting to support H433, a bill for publicly funded primary care for all Vermonters. Go to Pass 433 Now to get involved. Speak with your neighbors and collect signatures. It's not a big time commitment, and it could have a big impact. If the bill becomes law, it could help save lives and money and improve our healthcare system for everyone, yourself included. H433 is a bill currently pending in the Vermont House. When enacted, it will ensure that every Vermonter has access to comprehensive primary care. No premiums, no deductibles, no copays. You see a doctor of your choice when you need to see a doctor. You see a doctor regardless of your personal finances. Learn more at pass433.now. Those 188,000 underinsured Vermonters like Sarah I mentioned earlier, they will be fully covered. No more putting off seeing a doctor because the deductible or copay would swamp your budget. H433 phases in universal publicly financed health care with universal primary care as the first phase, followed by specialty care and sectors of care until everything is included over a 10-year period. Our current healthcare system is unsustainable. We can't go on like this. Medical debt burdens over 60,000 Vermonters. Families with insurance still go bankrupt from medical bills. People choose between prescriptions and groceries. School healthcare costs were the major factor in an average rise in Vermont property taxes of 14% in 2024. Every town meeting we hear the same story. School budgets are unsustainable because healthcare costs are out of control. Small businesses pay $18,000 to $24,000 per employee annually for family coverage. Health insurance is often their second largest expense after payroll. As a result, some small businesses drop coverage entirely. Young families are choosing to raise their children elsewhere because they can't afford health care in Vermont. Businesses relocate for the same reason. Entrepreneurs who would love to grow their businesses in Vermont don't come here because health care is just too expensive. For these Vermonters, our healthcare system has already collapsed. To help out, go to pass433.now. Just enter pass433.now in your browser and you'll get a website with directions, much more information on H433 and support materials. Do your bit. Don't wait. Pass433.now. Thank you very much.